Okay, so you definitely need health and safety. Health and safety management, if you've got one person, two people, it applies. So you definitely need it. It's the first things first. But the key is to keep it sensible, cost-effective, pragmatic. So don't tie yourself up in knots. Don't create bits of paper for paper's sake. And I like to sort of run people through a very simple sort of methodology, which is if you have 5 or more people, you need to have a written health and safety policy. That basically just is a statement of intent with a list of arrangements of how you're going to manage different subject matters. So think of working at height, asbestos, first aid, that kind of stuff. So health and safety policy is the first thing. Then what you need is access to a competent source of health and safety advice. That person can be either someone internally within your company who has an internal health and safety qualification. That could just be like an IOSH Managing Safely. That's a 3-day or 4-day course. Or what most people find more cost effective is rather than do that is they actually just subcontract it out to a consultancy such as ourselves who would take on that role, and essentially you would provide a helpline, email support, phone support, provide regular updates with health and safety updates, just be on the end of the phone and also be able to use your name as their competent person, which becomes important when you're doing sort of like a safe contractor, a CHAS or construction line accreditation, which you might need if you're working for the bigger companies. And then crucially, the cornerstone of health and safety, risk assessments, method statements. You need to have that in place. It needs to be written, but it needs to be written in such a way that the people doing the job know what they need to do in order to control the risks in terms of what they're doing on site. So don't put in that document sort of like a model answer of how you're going to manage working at height. So for instance, you might turn around and say, we will not use step ladders on site. Well, if you're going to use step ladders on site because you can and because they're not banned, don't put it into your risk assessment saying that you're not going to use them. Because if someone then falls off that step ladder, that is what's used in a court of law or can be used against you and said, well, you said that was how you were going to control the risk. So be very careful about what you put in that, and you don't need to have model answers. So that's a risk assessment. A method statement is essentially a sequence of works, how you're going to work safely. And then crucially, get that information conveyed to the people that are going to do the work. Otherwise, this is just filling in bits of paper for the sake of it, and that doesn't make anyone's life any safer or anyone's job any easier. Then what you need to do is make sure that your team are competent, skills, knowledge, experience, that have got the relevant training. So for instance, if you're working in a residential property and there's going to be asbestos around, people need to know, be aware of asbestos, so asbestos awareness training. So there's lots of different training that your people might need, and then you just need to work out, are you going to pay for that as their employer? Which if you employ them all directly, then it's your responsibility, just like you have to provide them with PPE. But then if they're obviously subcontractors and they're not employed by you, then there's a discussion point to have about who does that training. So in a nutshell, that's what you need to do with regards to health and safety. Keep it simple, keep it cost effective, and just make sure the most important thing is that the people doing the work know what's written in those documents.